Good morning, everyone.
Right here.
Can you raise your hand if you can hear?
Good morning.
Okay.
Good morning.
Good morning. All right. Well, why don't we go ahead and call the meeting to order? We want to move as quickly as possible because I know Tim has a family commitment at 10 o'clock, so we're going to go as quickly as we can this morning, although we have a lot to cover. Why don't we go ahead and, do roll call.
Okay, Dr. Smith.
Here.
Dr. McBride.
Here.
Reverend Duvall.
Here.
Dr. Garjanot. Dr. Khan. Have we seen Dr. Khan there? No. Okay. And Dr. Huebner.
Here.
Thank you. We have a quorum.
We do have a quorum. All right. So, as I said, we have a lot to cover this morning. The first order of business will be, we won't be approving last month's minutes because I omitted that from the agenda, so I apologize for that. We will do that next month. So the next item on the agenda will be the cost analysis review presentation that's been in the works for several months to try to get a better understanding of the per diem cost for each detainee. Scott?
Okay, they've done an incredible job. Lawrence, want to thank you and your team for all the work that you did, and look forward to your presentation here this morning.
Fantastic. Thank you all. Appreciate that. I'd also like to introduce my colleague and indeed boss, Bill Zizek, who's also on the line.
Good morning, everyone. Lawrence, are we able to get our slides up on the screen?
Okay. Go ahead, sorry.
All right, thank you. So good morning, Mr. Chair and members of the advisory board. Again, my name is Bill Zizek, Managing Director with KPMG. Was the project executive for this analysis of the county's correctional costs. I lead KPMG's Justice and Public Safety team and our work nationally with counties, cities, states across the U.S., focusing on helping agencies improve efficiency and impact in their operations in the criminal justice system. As mentioned, Lawrence Spinetta, Director with KPMG, is a senior leader in our justice practice and led the day-to-day effort in close coordination with leadership of Department of Justice Services, which we greatly appreciate. We're excited about this opportunity today to present you a brief overview of our engagement objectives, analysis, and 13 recommendations that we would offer to help the county further understand and improve the correctional system costs looking forward. And this brief talk today will summarize our 37-page report document that's been delivered to leadership of Justice Services as well as the county executive team to help guide decision-making going forward. Lawrence, I'll hand it over to you to further discuss our objectives and analysis.
Great, fantastic. Thank you, Bill. First, I just wanted to highlight Scott Anders and Tricia Rogers' help. They're super talented leaders and they provide some exceptional support and guidance for us on this engagement. And I think that the county is very lucky to have them at the Justice Security helm. Indeed, they showed some really great willingness to embrace our recommendations and pursue some opportunities. And because of that, we have some great news to share. Working together, we aggressively clarified with the State County Reimbursement Office categories of inmates who are eligible for reimbursement. And to date, we were able to generate over $400,000 and counting in windfall revenue for the county. And then we expect some reimbursement revenue going forward to also improve. So kudos to the Justice Security team. Additionally, in terms of good news, as Bill mentioned, we're able to develop some recommendations that are poised to make the county stronger. So with that, let's jump in. And I can't see the slides, or I don't know what slide number you all are on for some strange reason. So I'll just call out, perhaps we can go to the second or third slide. Let's go to the third slide that says context.
We actually, sorry to interrupt, we cannot see a slide deck. Is there someone who can share the screen?
Yeah, I just made, Lawrence, I just made you a presenter, so you should be able to present that slide.
Oh, fantastic. Yeah, it came on default. So let me see. Okay, can everybody see my screen?
Yes, there we go.
Fantastic. So this report was entitled Improving the County's Understanding and Recovery of Costs Related to Delivering Correctional Services. As Bill mentioned, there's a 37-page report. Here's the cover page, which you all should have copies of as well as our contact information on the right-hand side of the screen. Just a reminder of the context and the scope. In terms of the context, there was a feeling that perhaps that the reimbursement rates from the state and also from the municipalities were woefully inadequate to cover costs at $22.58 on the state side and $30 per day on the municipality side. Indeed, that's what we found. There was a large disconnect between actual costs and those charged for reimbursement for others. In terms of our scope, we were tasked with developing, validating, and presenting the jail cost analysis of the county. We started with doing a lot of research, which included talking to a number of individuals and staff members. This included the chief accounting officer and her deputy, the county risk county counselor's office, the chief information officer, an array of department budget analysts include public works and IT, as well as corrections medicine. And we really try to do a comprehensive job to identify both direct and indirect costs, as well as those that are, so this included, for example, fund, which is used to fund things like body scanners. So we were able to uncover those costs. Other costs, of course, justice service budget, corrections medicine. We found CARES and ARPA money, grants, depreciation, debt services, and pension costs. And the idea was to produce a fully loaded per diem cost. One note, though, that our analysis does not account for increased risks, such as political and operational risks, staff and inmate security concerns, and lawsuit liability from additions to average daily populations or events that could potentially exceed loss projection assumptions or even insurance coverage. So in a way, you can think about these as a minimum in terms of costs. Go to slide 4, and here is our results. You can see that the county's intuition about a mismatch in cost and reimbursement were correct. You see in the upper row, the total costs from 2018 increased from approximately 45 million to upwards of 51 million in 2021. In the lower part, you'll see the average daily population decreased down to a low due to COVID of 831 and then increased back to 923 this year. And you see the per diem costs associated with each of the year listed in the middle column, currently at $151.88, I believe. I'll stop here for a second and see if you have any questions before I jump on to a more detailed breakout. Okay, great. On the historical cost side, the dashed line is the average daily population of inmates. So you saw that decrease all the way through 2020, and then slowly starting to pick back up to more historic average daily population norms. In terms of the light blue is the justice services budget. You see that's fairly steady, but with some slight increases. But I did want to highlight not only the other categories, but in purple, there's corrections medicine. And we've seen correction medicine have some significant increases since 2018 through 2021, and that's driving some of the cost increases. and we have a recommendation later on that part of the budget. We also provided some scenario analysis to include step, fixed, and variable costs, and changes or projections on changes for average daily population. So what happens, for example, if you add additional 300 inmates? Well, that just takes you back to some of the historical norms, like 2018, approximately 1,200 inmates. You're going to have an increase in the total amount of costs. And particularly if you add 600 inmates, you're going to have to plan for a lot more costs associated with that. Happy to answer some additional questions at the end in terms of breakout costs, but I think that gives you a pretty good picture or summary of the cost to provide or to deliver correctional care. We'll jump over here to recommendations. Bill, anything else to add on the costs, or did you want to start with the recommendations, or should I dive right in?
Just to say that, as we deal with county and local jail systems nationally, we continue to see this phenomenon, especially due to the population fluctuations during COVID, where, it takes a lot of fixed costs. And when we say step costs, they're really step fixed. A lot of that is staffing and consistent overhead that's required to turn the lights on or to keep a floor or pod open in the facility. And so that's why we see a lot of that variability, and that's something that's happening with jail systems around the country. Go ahead, Lawrence, back to you to summarize.
Great. So here's a summary slide of our 13 recommendations. We've grouped them. In the upper left, you'll see it refers to recommendations on how to better capture inmates who are eligible for reimbursement from the state. We mentioned a couple different areas earlier on that $400,000 windfall to include including offenders who have suspended executions of sentences. We also improved the population collection or identification of those who are on parole. Those inmates who are also under 18 years of age, we've updated or helped Scott and Tricia update internal processes to capture those and to submit those for reimbursement. And we have a couple other smaller suggestions on how to capture some additional cost reflected on the bill of costs form, to include things like mental health examination fees, working in conjunction with the clerk of the court to do that. Any questions from the board on eligibility and invoicing the state? I think that's a good news story, because as the state auditor report notes, some of the laws are very inconsistent, and it provides uncertainty for the counties in how to invoice and to action that. And we were able to work nicely with the county reimbursement office to make those clarifications and increase revenue for St. Louis. Okay. Great. In terms of,
I might have one question if I could, real quick.
Sure, absolutely.
On your slide 5, I think it is, we could click on that one.
Yes.
So you said the justice services from the county, the budget for the county is pretty flat. The corrections medicine rose. Did you get a chance to look into how much of that might be due to sort of COVID related costs, or how much of it's due to increasing costs of the staff because of hiring costs or overtime or anything like that? Do you have a sense of that?
Yes. So we have some preliminary observations. The corrections medicine part was used 2.7 million from memory of FEMA, ARPA / COVID funds. That's not reflected in the purple, that's reflected elsewhere. So that's additive, but just straight budget. Two drivers in cost, Tim, as you pointed out. One is staff increases and also professional services. And one of our recommendations is to go more in depth into corrections medicine and look at the cost drivers associated with delivering corrections medicines to offenders. We think there's an opportunity perhaps to not only contain costs, but also potentially drive some more revenue. Just in terms of the staffing, from memory, I think corrections medicine had 13 open positions as of last month. So really, if you're fully budgeted, you're going to add even more costs for those 13 individuals. And right now, you're bleeding some money from increased overtime rates. But great observation.
Right.
Yes. And if I could just add, again, that's an area where local jail systems across the country are increasing their spending. We do see a lot of, not only increases in staffing as we've observed with St. Louis County facilities since, 2015, the trends of increase started well before the COVID period. But as you've contracted out, it's continued to increase. And so some of the recommendations that we'll make are around, making sure we understand the productivity and the performance and the volume and quality of care being provided. And we know that these are vitally important services. And of course, once people are in custody, if they were Medicaid eligible or Medicaid enrolled, they're no longer eligible. And so the costs fully sit on the general fund. And so those are all drivers that we're seeing happening across the country. And it's one that, we implore counties to start looking at whatever mitigations they can, up to and including how we manage offenders that have serious mental illness and serious health conditions, whether in custody or other alternatives due to their high cost on the system.
Yeah, those are very helpful responses. And in addition to everything you said about staffing, I know from my own institution that when COVID hit, we had to face some pretty much one-time costs with cleaning and, changing the way the building was configured, with testing, with all sorts of COVID-related PPE and that kind of thing. So I think that's probably reflected in those numbers as well. So.
That's right, Tim. And for our observation, we think that many of those costs, or at least a good portion of them, will continue in terms of sanitization and vaccination costs and protective equipment. So that likely will have to be rolled into the regular budget. Maybe now would be a good time to mention staffing, since you brought that up. But under number 10 for conducting a staffing deep dive and get well plan, we think that's pretty vital for the county. Not the least of which because of high number of open positions. We talked about 13 on corrections medicine. Last month there was over 74 for justice security. And it's not just the number of high open positions, it's the high churn and the low retention. Simply from an outsider, it's just a non-sustainable path. And that incurs, of course, additional risk for the county, both political and operational. And we recommend in our report focus on 4 different areas. The first is defining the requirements for the leadership's vision of the quality of correctional care, risk, and staff and inmate safety. So it's all about first defining your requirements. Second, it's about examining whether or not you're using your existing resources effectively and efficiently. And there's 2 aspects of that. It's an examination of overtime, because right now it's pretty excessive. And it's also taking a more sophisticated approach to scheduling. The third part of the equation is addressing some of the root causes. I know Bill will have some remarks, but it's just not all about pay, although pay is very helpful. Other things can improve the situation, for example, stability in scheduling. And then lastly, of course, to come up with a staffing strategic and get well plan. And from our perspective, other counties who have embraced a more end-to-end examination of requirements, scheduling, recruitment, and culture fare quite well and recover quite quickly. So the analysis should include things like a review of staff classifications, the mix of sworn versus non-sworn deputies, inmate classifications, and even the bed management system. Bill, anything to add on the staffing recommendation? as this is a major cost driver for you.
It is, and I would just say that the remark that, you know, a lot of our other counties have fared very well. I think it's relative. Everyone is struggling with this across law enforcement and justice industries, and really you're trying to mitigate. But it's really about what are the right tasks to be done, and breaking that down at a unit, pod level, floor level. Who are the right resources to be providing those tasks? What are the best schedules to not only provide for efficiency and coverage of the task, but also quality of life for the officers? And a lot of times what we find is counties want to increase salaries, which is always helpful. But what we hear from staff across the country is it's not just about the money, it's about the conditions and the workload and the stress. And so really getting an understanding of that bottom-up activity-based staffing picture is critical. Now, I'm just sensitive to time, and I know that, Lawrence, we were going to hit on a couple other categories, and there's one question that came in the chat. So obviously the recouping actual costs, the purple box in the upper right, I think it goes without saying, this information can hopefully help consideration regarding renegotiating contracts with the various parties that may use the jail. And also from a strategic perspective, you know, we applaud the county's efforts with respect to overall justice system strategy and the population review committee efforts that are underway. And we've added some additional thoughts based on work we've done with other counties to really drill into that population consideration. And what is really, number one, who are we seeing in the jail? How long are they staying? Some jail systems we see, sometimes upwards of 50% of bookings have a less than 5 to 7 day stay. So is this really, and then we're booking them in sometimes 10 to 20 times per year. So is a return to jail really the best outcome or the best intervention? And of course, the answer for many folks could be yes, but for many, the answer is no. And so we look at really drilling into the population because that's the biggest driver of your cost. That's the root cause there. And so it's also bigger than the jail facility. The jail is a hub, but it's a reflection of everything else around the system, from the law enforcement, arresting agencies, you know, the prosecution and judicial branches, as well as the health and social support services that may make it more possible to manage offenders in the community on either pretrial supervision, other types of program-based support in the community, or indeed serving their sentence through some other sort of community-based sanction with the appropriate community-based support. And that's more than just, you know, jail services and probation supervision. So we offer those recommendations in reflection of that, and know that the county is doing a lot in those areas already, and have offered those to help further where you all are going. And then my last point, and then we'll stop for any final questions, is just to really again commend the leadership of you know, Acting Director Anders and his staff taking action. They're not waiting for the ink to dry on this report. They are taking action to getting these things implemented, and we're happy to have played a part in that. So with that, I'll close and just say thank you again to the advisory board to present, the county executive's office for their guidance, and of course the leadership and staff of justice and other departments who contributed to this. And we'll turn it back over to the chair for any final questions.
Thank you both very much for your presentations. I don't have final questions. I have one kind of just thought from a strategic standpoint on the, you know, point number 9, collaborate with other counties to accurately measure correctional costs. You know, this is going to be something where if it's just St. Louis City and St. Louis County and Jackson County going to the legislature, we're going to lose. So I would encourage you to reach out to Franklin, Jefferson, St. Charles, Lincoln, Boone, Greene County, you know, Springfield, Christian County, like the mid-sized counties, to build a coalition of red counties and blue counties to go up to the legislature with, because if it's just seen as an urban versus everybody else, you know, it won't work very well. Because, you know, it is, you know, obviously it's uniform. This 2258 is uniform across all the counties, which is ridiculous, you know, since the cost structures are so different, urban versus rural. And so we definitely will need to find some of those mid-sized counties that may be in the 40s or 50s, you know, or something like that, they're getting screwed. They're not getting screwed by as much as we are, but they will have an incentive. It's the Office of Administration, you know, that calculates the rate. You know, but you could probably build some bipartisan consensus around, you know, doing some statewide study of, you know, to more precisely calculate it county by county. And that would be hard for a rural county to oppose, right? Because, so anyway, those are kind of my strategic political thoughts on it.
Okay, great. Excellent. Yeah.
Bill or Lawrence, do you guys have any thoughts on that based on what you've seen in other states? Because I'm sure these, you know, metro versus non-metro disparities exist everywhere.
Yeah, they definitely do. And I know as part of this project in our report, you'll see detail on the survey that was done by the Missouri County Sheriff's Association, where it shows the variability of known costs. But we do think even in those urban, rural and semi-rural counties that those costs are probably not fully stated and haven't been based on sort of an exercise that we've gone through with you all. But I would completely agree that that is what's necessary. And now is actually a good time. Some of the other states that we're working with, such as Kentucky, which has, you know, a similar dynamic of red and blue and urban and suburban and rural counties, have done just that. The state has used some of its ARPA money to help top up those per diem costs, but the state rightfully has also added some incentives to say we want to see more rehabilitative programming. You know, we don't just want to, you know, pay this for just pure incarceration. And so I think there's definitely a conversation there, and having balance across the political spectrum and the urban rural spectrum is extremely important to make that case. I also note that in the analysis, Lawrence, correct me if I'm wrong, but not all counties reported in that, but there were upwards of 50 counties that had submitted that their cost detail, even if it wasn't, you know, fully analyzed.
You're exactly right, Bill.
Bill and Lawrence, we're going to have to move on for another presentation, but I wanted to recognize everyone for your work on this, and just even if we only took the average of those 50 counties, we would double what we're already recovering. And so reaching out to the Missouri Sheriff's Association is a good starting point, and we'll look to the advisory board for advice on how we can move this forward more quickly, because I think to get it on the legislative schedule for next year, we have to get this submitted by the end of December. And just the revenue that you've generated from the recommendation to reimburse probation violators, you've already generated 800% more than the cost of your evaluation.
That's
good.
Generated, and thanks so much for all your work on this.
Thank you. We appreciate it.
Thank you all.
All right. We have another finance-related study to discuss. Scott.
Yeah. So I know that we've had an evaluation of our financial system by KPMG, and it includes personnel information. So we won't be able to do that in an open session. The evaluation itself has made several recommendations that will help us improve our efficiency, how we track things, and there'll be more information available in a closed session presentation if it doesn't include personnel.
Okay. I would like to get that additional information. And so accordingly, to get the additional information regarding the financial audit, I would move that we go into closed session pursuant to section 610, 021, 113, and 19, and sections 114.020, 113, and 18, which relate to confidential personnel information.
Second?
Second.
Thank you. Okay. Dr. Smith?
Yes.
Dr. McBride?
Yes.
Reverend Duvall?
Yes.
Dr. Huebner?
Yes.
Dr. Khan? No. And Dr. Garza, no. Okay.
And just a note to the attendees, I haven't started that closed session yet, so you'll have to give me a couple minutes once we leave this session for me to get that other session started before you join in.
So are we supposed to leave this one or keep it open?
No, you'll have to leave this session, unfortunately, and go to the new session. And then once we end that, we'll have to come back to the open session.
Okay.
I know it's difficult, I apologize.
Do we have a link for the other session? Are you gonna send that out?
We got
The
it.
link was sent out about 2 o'clock the same day this original link was.
Okay,
It should be titled Closed Session Advisory Board.
okay.
Aaron, if you can hear me, I made you the presenter early, just so you have the controls.
Sounds good. Thanks, Ray.
Yep. Who are you missing?
We're missing that.
I think she had the end at 10 on.
Yeah, well, I emailed her to see if she could. Tim, are you still on?
I think he had to drop off.
I mean, you know.
Had no quorum, we just.
Right.
Yeah,
We don't have a quorum.
Yeah, no, I mean, we don't have a quorum, but I mean, we don't even have a quorum to adjourn the meeting, which is,
Let me see if I can, send him a reminder, maybe he'll come back.
I emailed Beth to ask if she could just jump on so we could adjourn, to do it properly.
Jeff, this is Valerie. Dr. McBride did say that he had to step out of the meeting.
Yeah, I know, I just. Well, there may be a Robert's Rules violation here.
Speaking of Robert's Rules, if you guys could, I think, and this doesn't happen a lot, but I think you could vote to postpone the remaining agenda items. But like you said, we need a quorum, so
Yeah.
we can get someone to call in.
Well, Beth says she cannot.
I can't.
I already asked.
Give me a second here. I'll find something. You guys know me. I'll pull a rabbit out of the hat. Hold on.
Beth is back.
Oh, there's Beth.
Okay. Beth, thank you.
Okay, do your roll.
Okay,
Just do a quick.
so yeah, so I move to postpone the rest of the agenda items, and to postpone the rest of the agenda items to next month and adjourn the meeting. Is there a second? Second.
Okay. Dr. Smith, oh, he's not here.
Yes. Oh.
I'm sorry. Dr. McBride, who's not here. Reverend Duvall.
Yes.
And Dr. Hubner.
Can't speak, but it's there.
That's a check.
Okay, very good, thank you.
Get adjourned. We'll do the rest of this stuff